like that transition from pediatric to adult, it's very different. And so being an adult, living in the adult world, and then seeing the pediatric, I was really grateful in some senses that she was diagnosed with an autoimmune disease when she was a kid.
Hi everyone, welcome back to this week's episode on Take a Pain Check. We're joined by McKinley, who's a student athlete, health advocate, and a future healthcare professional, and her mom, Lisa, who's been by her side ever since the beginning of her diagnosis journey. So, McKinley, Lisa, thank you both for coming on the podcast. Can you both start by introducing yourself? Tell me a little bit, about what you've been up to recently and what you're looking most forward to during the summer break if you have one.
Hi, yes, thanks so much for having us.
Thank you for having us. We're really honored to be here.
Well, I'm McKinley, and a little bit about me. Yeah, I love lots of sports, play basketball. My summer's filled with lots of training, working. I work at a medical clinic, so.
And my name's Lisa. We have 3 kids. McKinley is our oldest, and she has 2 younger brothers. And I think this summer, she's home for the summer, so that's really nice. She moves back home in the summertime, so it's nice to have all 3 kids again under the same roof. Her brothers are thrilled that they have her back to kind of play with, and I have someone extra to keep them in line, so it's good.
Yeah.
Hey, thank you so much for sharing. So where are you based out of? And McKinley, where do you go for school?
Yeah, so we both live in Red Deer, Alberta. For those who don't know, it's right in between Calgary and Edmonton. And I go to U of A, so to Edmonton for school. And I'm studying kinesiology there.
Nice. So how do you kind of balance like the sports and the studying and kind of do it all? I feel like you do so much.
Yes, it is a lot. It's definitely a big balance. For us student athletes, we do only take 4 classes in 5 years opposed to a traditional 5 classes in 4 years. So it helps us balance things a lot more than trying to balance 5 classes as well. That would be a lot harder. But it definitely is a big balance trying to balance practices on top of game weekends where we're gone for tournaments or whatever. But it's definitely fun. I really enjoy it.
That's so great. So McKinley and Lisa, you're on this podcast because McKinley, you were diagnosed at the age of 9. Can you tell me a little bit about your diagnosis and, what were some of the first signs that you or your mom noticed?
Yeah, I think growing up, I had always had kind of random health issues. I always had, I was a very active kid. So growing up, I would always have, aches and pains or, just random stuff happening with my body that we generally, as an active kid, could be considered normal. And then the first signs, what were the first signs for?
I think for Kin, she has psoriatic arthritis diagnosis, and then also has masts. If you want to share, what are your diagnoses? And then I can kind of speak to when we saw it.
Yeah, so I was diagnosed with psoriatic arthritis, mast cell activation syndrome a couple years after that, and then POTS, postural orthostatic tachycardia syndrome, about 2 years after my MCAS diagnosis. So those have been my 3.
I think looking back as a mama, we can kind of tease apart some of her symptoms. I remember her on her 4th birthday crying because her head hurt so bad. And so we started noticing she had emergency CT and some head and stomach aches. She was diagnosed with abdominal migraines when she was younger as well. Looking back, we think those were probably the immune disorder with the mast cell activation syndrome. But then the joint stuff and tendon was pretty consistent. We started taking her to physio at age 5, all the way up to 9. We were back and forth with rheumatology several times because she was presenting probably kind of typical for psoriatic arthritis. So rheumatoid factor was negative. All her blood work, she wasn't had any inflammatory markers that were high. Not a lot of red hot swollen joints until finally she did, but lots of enthesitis stuff. So lots of pain and lots of kind of periods of immobility.
And McKinley, while you were growing up, what was going on in your head when you were feeling those symptoms? You were in school, so what was that like?
Yeah, it was definitely hard, especially since I was such an active kid and I always would be unable to play this sport. Or I remember there's a specific summer where I'd normally do soccer and run triathlons, and I had to choose which sport I could do because my knees wouldn't allow me to do both. So it was definitely really hard trying to balance like what I wanted to do versus what my body would let me do, and it was really frustrating. I remember that a lot, just being really disappointed.
And Lisa, in terms of your other kids, like, are they healthy as well, or do they have any conditions? Like, was it surprising that McKinley had this? I know, McKinley, you are the oldest, so what was that like?
Yeah, I think because so I myself have psoriatic arthritis. I was diagnosed in 2010, but looking back, my first symptoms started probably 10 years prior to that. So I knew what the disease looked like. And I think as a mom, that was really hard because I could see it playing out in her. It not doesn't always present the same, but in her it was very similar to mine, especially that enthesitis piece. And I also knew the sooner we can get her diagnosed, the sooner we can get her on meds, the less damage it was going to do to her joints and potentially could put it in remission quicker. And so I really felt that ticking time bomb in my mom heart of being like, I know something's wrong. I'm pretty sure I know what it is, but um, we just couldn't firm up that diagnosis until the age of 9, until she finally had a joint that was swollen. But no, the two brothers also, so they have our middle one, he just graduated from high school. He was pretty healthy until he got bit by a tick. He got Lyme disease, and then he got mast cell activation syndrome as well, and also has dysautonomia. And our youngest, when we figured out McKinley and Cohen, we were like, oh, we probably understand why you have all sorts of these XYZ symptoms. And so he also got tested and diagnosed with mast cell activation syndrome and dysautonomia. So Kin's the only one right now, well, the only one that has autoimmune disease. Brody, they think maybe he has some enthesitis related arthritis rumbling. He has seen a rheumatologist before, but so far so good for for the boys.
Wow, so that's a lot as a parent to just kind of navigate as well, and even for your kids like being so young. Can you tell me a little bit about the mass activation syndrome and what that is?
Yeah, so it's a lot of my symptoms are like I guess randomized. Like, can you explain a little bit about this?
Explain it for you. So the science piece, so it's so mast cells are like when you have an allergic reaction. So if you were to go outside in the summer and you react to pollen, you would get like itchy nose or runny nose. And so it's because the mast cells are degranulating. And with this disorder, the kids' mast cells degranulate completely randomly and improperly, and sometimes all the time. So things it's so unpredictable. So our middle one started going anaphylactic to foods he'd ate his whole life. Um, and so for Kin, she often would be reacting to like,
I had exercise, hot showers, I had different foods, I would have walking outside into the cold weather. It was like anything that was, yeah, temperature change or food or like even smells, different perfumes or whatever would just, yeah, make me sick.
and the reactions can be from like a runny nose to all full blown anaphylaxis. So you also get a spectrum. So each of the kids had similar triggers, but also different ones too. And they all had different sort of spectrums of reactions. So once we tease that out and we're able to put them on medications to stabilize the MCAS, it really helped with actually her psoriatic arthritis too. And when we probably will get to it later, when we had flown to a conference in the States on mast cell diseases, one of the specialists there was leading a study on juvenile arthritis and mast cell diseases because they really think there's a link there. So
That's so interesting. And actually, yeah, I do know a few patients that do have both. So
mhm.
it's definitely not just like you, it's lots of patients. So that's interesting that they're doing research about that. I think that'll definitely help a lot of patients in the future. But Lisa, like you also mentioned you had psoriatic arthritis. And so I wonder if you could talk a little bit about the healthcare changes, like from the past that you faced and the challenges that were maybe there and how you've seen it healthcare evolve now for McKinley.
That's a good question. I would say pediatric healthcare, and I've heard it before on a lot of your other podcasts, like that transition from pediatric to adult. It's very different. And so being an adult, living in the adult world, and then seeing the pediatric, I was really grateful in some senses that she was diagnosed with an autoimmune disease when she was a kid, because the care is so much better. Immediately you have access to like physiotherapists, like social workers, OT, PTs, like it's just a team of people. Whereas when in the adult world, you're on your own unless you happen to see a flyer and rip off some sort of information in the waiting room. So I would say that with the pediatric world, it's much more team approach and much more, user friendly, easier to get a hold of people. They are making exceptions, or not exceptions, but they have urgent spots all the time. It's just much more, I would probably patient orientated, whereas in the adult world, it's not quite that slant.
And then what about the transition from pediatric to adult rheumatology care for you, McKinley? Because I know you were diagnosed at 9 and now obviously you're a university student. So how was that process for you?
It was definitely a change for me. Thankfully, my arthritis has been in remission. And so when I was able to make that transition, my arthritis has been relatively quiet. And so I haven't had to see my adult rheumatologist as much. But even going the like 2 times that I did, it's a big change. Just the way that everything's kind of approached, or just like, the team, I guess, behind the care. But so far it has been good.
And I think too, I can also add to that, when pediatric, like it's like they become your family. And especially when the kids are in a flare, you're there so much, sometimes weekly. We live about an hour and 45-minute drive from our children's hospital either side. And so sometimes, we're there a lot, but it's
Comes your people.
Yeah, they become kind of almost like your family. And so, but it just feels a little bit more separated when you're in the adult world.
Yeah, I feel that with me. And also, like, I found that, pediatric rheumatologists, you get to know what their like kids are doing and like
Mm-hmm.
that really friendly environment. And then adult rheumatology, it's like, okay, let me write a list of what I have to say because I have to get out of here in 20 minutes.
Yeah.
Right. So it's a big change. And I feel like we learn how to adapt, but it's just like really abrupt. And a lot of people do get into those transition clinics, but some people don't. And so it's kind of just how you navigate that. So I'm glad that your transition was pretty good and everything's good as well now. But a lot of your diagnosis has been, when you were in school. And so I'm curious, like, what about accommodations? How did that work for you if you had any? And what did your teachers or peers say? And did your mom have to, advocate for you in the school setting?
Yeah, for sure. I think for me, I did have a decent amount of accommodations. I think it was about my grade 4 school year is when I really started having trouble with my arthritis in school. Um, I remember, for example, I'm sure a lot of people relate those finger grips on pencils, to having to talk to type on computers because you weren't able to type with your fingers, or having to be pushed in a wheelchair around the school because you can't walk. There's lots of different accommodations that my teachers, and thankfully I had really great teachers. They all understood what I was going through, and were trying their best in whatever way they could to accommodate whatever I needed, and never push back or was questioning whether I actually needed them or not. So I was very thankful for them. Um, and yeah, I think it was, and for peers wise too, like I always was nervous about what other people would think about me, especially like grade 4, right? You're still so young. And I was always worried that people would think I'm faking it or doing things for attention or just not actually in pain. And so I would try and like limit, I guess, my accommodations to like I wouldn't use it unless I like actually had to. Um, and that was kind of for me a hard part because I wouldn't be able to do anything, but I still wouldn't want to use the accommodations. But thankfully, they were all there to help me get through.
And I think one piece of the accommodation to add from a parent perspective was, so when she was on methotrexate, her immune system was really bad. And so we kind of had to figure out and brainstorm with her teachers, like, how do we approach that? And so I remember like having like a system of disinfectant wipes kind of at her desk. She would have her own pencils and her own sort of like textbooks, and we sort of like tried to minimize the amount of things that were being touched for her. So that was a piece that maybe I didn't necessarily initially think too much about. I kind of thought more about the practical piece, but it was also like her immune system piece and how do we do that? And then post metho, we would do it on the weekends. Mondays were still really rough for her. And so she had I think she worked out a signal with her teacher that I don't remember what the signal was, but yeah, she had a signal, and I think the teacher just put up her hand, and the teacher nodded, and she could leave because she was either sick or so tired that she needed to go for a walk. So I think our experience, they were really supportive. I know that's not everyone's story, but those are some of the things that we kind of had to work through.
That's really great for sharing. I mean, it's really good to hear that, you had a positive experience, but you're right. A lot of people don't. I didn't either. So it's not easy for everyone. And I think it's just kind of like a hit or miss. Like you get people who understand and want to be compassionate and caring, and other people just, it's another thing they need to think about and they don't want to bother. So it's quite unfortunate. But I'm glad that you were able to kind of advocate in that setting if you ever needed anything. I wanted to talk to you about mobility aids. So can you talk a little bit if you have had any experience using them in the school setting? And if so, or even outside of the school setting? And if so, were there any comments that were made?
Hmm. I would did use mobility aids quite a bit. Most of it, like for the tendonitis piece, it was a lot in my knees and my bottom of my feet, my plantar fascias, and my Achilles, the back of my heel. Um, so when those were flared up, I wasn't able to walk. So I would use crutches, canes, or wheelchairs depending on how severe the flare was. So I remember I did not like using the wheelchair at all. It was my least favorite thing to ever be in. But I would use crutches quite a bit, as I just normally have like one foot flared at a time. And I remember using it around school. I always felt so awkward because yesterday I showed up with no crutches and everything looked totally normal, totally perfect. And then today I show up and I have this splint on my foot and I'm not able to walk. And then the next day I might be fine again. And I was always worried that people would, doubt me or just kind of be like, what the heck is going on with you? Like, why are you drawing all this attention? And I can't remember any specific negative comments that were made towards me, like to me. Um, but yeah, I do remember just this feeling of doubt from other peers around me in my class.
And I guess during this time, Lisa, like whenever McKinley did have any sort of issues in school, or how did you support her during those times where she felt different or misunderstood?
Part of it was I understood. And so I mean, the kids remember before my arthritis got under control, I was for a time actually in a wheelchair too and had different mobility aids until we were able to get myself medicated and on the right meds. And so um, I understood what the pain felt like. And so part of that was hard, I think, as a parent, because you literally know what they're feeling emotionally as well as physically. But I think also part of that was probably helpful because she knew that I understood. And so I think there's that piece that your organization really does is connecting people so that they don't feel like they're alone and so that they don't feel like they're the only people, which is so important. And in our journey, we didn't know anyone, especially initially, that anyone like her. And so at least the two of us we just got it. And I think as a parent, you put on a brave face and inside you're just dying. Your heart's breaking. And so we were always quick to figure things out. I remember a couple of times putting like an SOS on my Facebook, like, does anyone have a wheelchair? Because we wanted to go to like some Christmas craft show and she was in a flare all of a sudden. And so I was like, well, we're going to take her. We're not missing it. And so I would find a wheelchair and we would take her. Or she got another flare one time in the summertime and we were going on a family holiday and we brought our bikes and she was probably 11 or 12, but I was like, well, we're going to figure out a way to bring her along. And so I borrowed a chariot. On my little thing, does anyone have like a chariot that we could pull her in our bikes? And so you got really good at pivoting and also trying to figure out how do you make her life as normal as you can, without understanding that you can't make it perfect, but you really want to try to make it still feel like it's somewhat normal and she can do the things that she still maybe wants to do, but just looks different.
Looking back and basically both of you growing up with this disease, is there something you wish you knew when you were younger that like now you're like, oh, I wish I didn't think this way, or I wish I didn't do this or that? Like, is there anything that you are looking back and you're like, oh, well, why was I thinking that way, or something you would change?
I think for me, it was always that self-conscious piece of always being not necessarily so worried about, well, it was about what other people think, but just in the sense of like, just being like, yes, this is what's happening to me, and not worry about how people are thinking about me when I show up on crutches, or how they're thinking about me when I'm having this flare or whatever. I think that was a big thing for me growing up. And then I think another big thing for me that I wish I like had known, or like would have been like super inspiring, was I remember us looking up athletes who had arthritis in the Olympics. You're like, is there anyone out there who has arthritis and like has been successful? And I think being able to know that like there are people out there who are able to overcome their challenges, like it would have been super, super inspiring. And so looking back, that would have been super, yeah, super helpful.
I think for me as a parent, you lose a lot of sleep. You lose a lot of sleep before their diagnosis, you lose a lot of sleep after their diagnosis. And so if I had known, I think because of McKinley and a lot of her health conditions and a lot of our family, we aren't textbook. We don't fit into your checklist box. So it's very stressful to try to figure out what does she have and then how do I get her help. And so there's a lot of medical trauma essentially on a parent's heart to try to feel like the weight of that responsibility to navigate their way through. And once again, back then there wasn't any organizations other than the Arthritis Society, which is great, but now they've got Cassie and Friends, and they've got You Guys Take a Pain Check, and they've got other things here in Canada that really help families navigate through that. So I probably would look back and just tell myself, like, don't lose as much sleep. It's gonna work out. You're gonna figure it out, and but it's just gonna take time.
Yeah, definitely relatable here as well. I think McKinley, like having more stories to listen to would have been helpful for me. It's just like knowing that people have done so much. And like that's why I brought you both on the podcast, because there are people listening who may be losing hope, and you have done so much, which we're going to talk about soon. And you've shown resilience, and despite your diagnosis, you've been able to show that you can still do what you love, which is basketball. So we'll be talking about that. So I want to talk about, how did you get into basketball, and what maybe set you back at some points, and how did you stay connected to it and continue doing what you love doing?
Yeah, so I think I like actually started basketball about grade seven-ish. Before that, I did a lot of soccer, yeah, triathlons. Soccer was like my favorite sport back growing up. Um, and basketball, I just kind of fell in love with it in grade seven and continued it on. I love the like team aspect and the competitive part of the game. But I think the challenging part in basketball was also the um, uncertainty of every single game, every single day, every single practice. It was very hard you're able to do, especially with my pots, I'm able to do some drills, but other drills would make me flare up. And so it was hard to try and tell coaches, like, hey, if you want me on your team, like, I might be able to play basketball, but I'm not able to do a burpee. So we have to do burpees. I'm gonna have to sub that out. Like, it was hard to try and like even just from a going to a coach perspective, like, oh, who is this person? It was kind of hard to navigate. And then it was also like even before I played basketball, growing up with the soccer piece, which is more when my arthritis was very prominent. Um, it was always a guessing game whether like I would have to like pre-medicate before with Tylenol just to be able to like play a half of a game, or just like anything I would do to be able to just get on the field as long as I can. And then I just remember the next day I would just crash, but I just loved playing whatever I could, and so I would take what I could get. But it was very hard to try and keep navigating when you just feel like every single day and every single game you play, you end up taking the next 3 days to recover. So it was very hard to try and keep going, but I just had this passion And it wasn't necessarily basketball at that point, but it was still the sports aspect of it. And that's what made me want to like keep going. And even though my body eventually just couldn't go anymore.
And I think too, for watching as a parent perspective, that process, once she got into grade 8 and 9 is when she kind of had her other diagnoses. And so once we were able to start managing the conditions, it was like whack-a-mole. And finally, eventually things started to kind of settle. And so then she began to push her body a little bit more, a little bit more, a little bit more. And then it would push back, and she had a lot of enthesitis issues and a lot of other stuff come up, but she was still able to like stay in the game per se. Mm-hmm. And then probably once I would say high school hit, sort of is when she was really able to push her body to that next level where she needed to be able to do that in order to keep up with the level of athleticism, but also her conditions were managed enough where it allowed her to do so. Because there was no amount of stubbornness could have ever helped her weight bear when she was in a full flare. Like, it's not like you can muscle your way or like positive think your way through these things, like especially with arthritis. If your joint's flared, you can't damage the joint. Like you can't be, and so it was just a matter of conditions were managed enough, and then she could start pushing, and then slowly that dance became better and better.
Yeah, I mean, I'm glad that you were able to still continue doing what you do, and you've done so much. And in addition to that, now like looking back and seeing all those challenges, you are now an athlete, and like, what does it mean to you now to have gone through all of this and being able to play at this level now?
Yeah, it means a lot. I definitely don't take anything for granted at all. Especially when I look back at the year I just completed my first year, and I'm amazed at the level I was able to push my body. I never ever thought I'd be able to do what I just did, like play basketball at a university while taking school. Like, it's a lot of physical, mental, and emotional demand, and it was not close to being possible when I was younger. Like, it wasn't even a thought. So it's been definitely a blessing to be able to be where I am right now, because I never would have thought I could get there. So every single time I'm able to do a milestone, like, yeah, even be on the team, playing a game, whatever, it brings me back, like, reminds me like my body's allowing me to do this. Like, it's amazing. It never is always like this, and I can't take it for granted, because it might not always be like this, but for the moment I am in right now, it's always brings me back to points where I'm like, I'm very thankful where I am, because I knew how hard I had to work to get where I am today.
Not only do you play basketball, but you also do hospital advisory work, fundraising, presentations, other extracurriculars. So can you tell me a little bit about, your advocacy journey, your extracurricular involvement, and what you do and why you wanted to get involved at so young?
Yeah, for sure. I think my first involvement was kind of first when I was diagnosed with arthritis. We got involved with the Arthritis Society and did a fundraiser with them. So in like a year, I think, after I was diagnosed, we kind of did a fundraiser for the both of us, for the Arthritis Society. And that's when I first like put out my story and was like kind of advocating for what I had been through, we had been through. And we were able to raise quite a bit of money for the Arthritis Society. And then after that, we organized was it a walk or a run?
Yeah, that was part of it.
Mm-hmm. Yeah, here in Red Deer, which it had never been done before. And then I think I after that, I got involved with the Child and Youth Advisory Council in the Children's Hospital in Calgary here. They kind of have a council where they have different youth from like, they have all these different perspectives, and there's topics brought up by the hospital, and we kind of give our feedback, opinions on what our experience has been and how we think about this. And I think I was very intrigued to join it because all the experience I had been through, my brothers had been through, my family, like, I might not have been admitted to the hospital for a particular reason, but I'd seen a lot of the outpatients, all the outpatient clinics. And so I was really like, okay, like, I want to give feedback. I want to share my story, and I want to give perspective so I can help other people who will be going through here. And hopefully maybe make some changes that make it more helpful for them. So I think that's where it really started. And it's just been, yeah, I've really enjoyed it.
And I was going to say, like, as a parent, it's interesting because I had the conditions for so long and I never really was super involved in advocacy. And then my kids got sick. And then I was like, okay, is a totally different thing. And so I jumped in with both feet and I was like, okay, well, if this disease is going to affect me, it's one thing, but if it's going to affect my kids, then we need to figure out a cure. And so that really motivated me to get involved with the advocacy and the fundraising. And I also became a family and patient advisor with Alberta Health Services, because we had so much experience with the kids and we've seen pretty much every specialty at the Children's Hospital looking for diagnoses, and then also with the comorbidities and things too. But yeah, just wanted to help make things better for patients, and had a real vested interest when it becomes your children.
And McKinley, you did a presentation in grade 4 to educate your classmates. Can you talk a little bit about that? Because I know I never educated my classmates, or like my parents didn't either. I think it was mainly like, let's just talk to the principal, or if I want to talk to my friends, I can. But that's a big thing to do. So tell me about that.
Yes, it was. I think it had been brought up to you through the Arthritis Society. They'd kind of said like, oh, like we have this kind of program that like you can take pieces from if you ever wanted to share your story to your peers, your classmates, to kind of let them know like, hey, this is what's going on to me. This is kind of this is what arthritis is. This is how it looks like in me. And so we're like, okay, like I'll do it. Like I was in I think the class, it was about 60 kids, and like it was, we'd all been in class together for like 4 years, so I knew them pretty well. I wasn't in a new school. And we kind of come up with this plan to kind of, it was like, we just explain kind of, hey, this is what arthritis is in a very grade 4 kid version. And then kind of said like, this is how it looks on me, and this is why sometimes you'll see me with crutches one day, or a splint on my wrist one day, or this is why I might have to leave the classroom at one point, or kind of explain whatever. And then the one part I remember specifically about it was we did a demonstration, some challenges. Yeah. And it was like we'd time you, see how fast you could peel an orange with gloves on to mimic like you're in a flare and you can't really use your hands. Or we would also time like how long can you put on all your splints and crutch to the bathroom, is if you're in the middle of the night and you needed to go to the bathroom. Like we remember doing those, and it was pretty funny to watch the other grade 4 people trying to complete challenges, but it definitely made it memorable, and kind of I'm hoping they took something away.
Me too. That's so interesting because they could really understand or try to understand better. I'd say like what you're going through. No one's ever going to fully understand that, but just kind of giving them a perspective is important. What message do you hope to give other young people living with these invisible illnesses? Because I know like all these illnesses could be pretty invisible depending on how, severe your disability might be. So what message do you hope to give other young people who may be struggling with kind of their identity and finding their voice?
Yeah, my message would just be to never give up. Like, as you said, our journey, it took a lot of time to get me where I am today, and it was not easy. But don't ever lose hope. Like, it will get better. You will find answers, and it will be hard and it will be very frustrating. But just don't lose hope and keep fighting, because that's where change will happen.
Yeah, and I think I would add to that too, is like, you're not alone. You might feel alone, but you're not. There are a lot of people with all the various health conditions. And with today, like with the internet, my Facebook is filled with like parent groups of like parents of kids with autoimmune diseases, parents of kids with dysautonomia, parents of, like, it's all that, right? But the networking is completely, like, it helped, I would say, like, helped my kids get diagnoses, because when we didn't understand what else was happening, we knew the arthritis piece, we got that figured out. It was a lot of FBI work on the parents to figure, okay, what about this? And then maybe we should ask for this test. And so I'd probably say, like, to the kids and the parents, you're not alone. Don't give up hope, especially when your diseases aren't under control and you have to keep going through different medications, and it's so discouraging, and they take so long, like up to 4 weeks, a lot of the meds, to even try to see if they're actually going to work. It can be very discouraging, so just don't give up hope. You will find a medication one day, that, or a combo of them. You can't lose that hope. And then just you might have to pivot. So sometimes, you might have to, like, one of the things Kin always really wanted to do maybe was a physiotherapist, always, always, always. But the reality is for her is using her hands as her job, specifically with physio. She was like, I don't know if that's actually something I can do, but I love healthcare. What about OT? What about, like, there's so many other things. And so I think it's also learning that you do have to pivot sometimes, and that's okay. But just trying to keep an open mind to that.
I wanted to also ask you, like, what was your medication journey like growing up?
Yeah, I think you could speak more to that. I was I can't remember what
You
I was
started
first
off
put on.
naproxen.
Oh, I was first put on naproxen.
It wasn't
Yeah.
doing anything. And then you went on injection with the methotrexate.
Yeah, then I was on methotrexate for an injection for like 8 months, I think it was. Or about 4 months. The first period was the injection, and then I got super, super nauseous in the anticipation of the injection. So I switched to an oral form, so pill form, and was on that for another 4 months. And then also, I think it was like prednisone here and there. I was on
Also, we started off with sulfasalazine. So just in between the naproxen, we always had the naproxen, but we went actually sulfasalazine first, and then she had what we think was an allergic reaction. So then we went to the methotrexate and the injections, and then that was really hard. She was really sick. That was really hard as a parent. That's like, oh, I told her, I was like, I probably won't cry. I'll try not to cry, but like, it's awful having to inject. I would do the injections because I knew how to do them from doing them for myself, and so I felt comfortable to be able to do them. And she had preferred me then versus like a different going to the doctor. But it was awful knowing that you were injecting them with something that isn't the best for them, but that you had to because they needed to be able to have a quality of life, and you knew that there were risks with putting that medicine in them. And so I'd be brave, and then she'd go to sleep, and then I would go and cry, and that would kind of be my cycle as a parent each week. But then her nausea was so bad that we started to notice the anticipation of the injection was starting to get hard for her. And so we came up with some strategies working with her team, which was really helpful. And then we switched to orals, and that was easier on the anticipation, but we changed our metho nights because we used to do it Friday night, and then she'd be sick all weekend. So then we tried maybe doing Saturday, so she had half the weekend. So we really played with that. But
Yeah, I mean, it's hard, definitely. I mean, I find it hard to inject myself, and then like seeing my mom want like she was doing my methotrexate ones, and then after it came to biologics, she's like, I'm not doing this. So, it is a challenge, and I can totally understand as well. Would you say that your like symptoms right now are pretty well managed for your psoriatic
Yes.
arthritis? Okay.
Yes, they are. They're very well managed. I'm only taking naproxen at the moment, and that's been able to keep it all at bay.
That's
So they're
amazing.
very, very well managed.
What about you, Lisa?
yeah, so my story is a little bit different. I started on naproxen, and then I went to flumenide, then sulfasalazine, and then went to Humira while on metho and um, naproxen. And then I ended up getting diagnosed with non-Hodgkin's lymphoma. And so when I did, they pulled all of my immune suppressing medications. And so we thought I probably would have about 2 weeks of mobility until it came rushing back, the psoriatic arthritis, until I was done my radiation treatment. But thankfully, the medications pushed me into medicated remission. So I'm actually not on any medication at all for my arthritis for probably, I guess it's been 7 or 8 years. So I'm very thankful for that. But yes, have been through a lot of the medication journey and insurance coverage and trying to get, yeah, it's been a long journey.
I mean, yeah, it sounds like it definitely has, and it's not just, one person in your family, it's definitely a whole family getting through this. So can you talk about how you have been able to support each other and what your support system looks like outside of your family as well?
Um, I feel like for us, like even that we both have like arthritis, like she said, like we always kind of understood what we were going through. We always felt, yeah, like we understood. And then for the family, while we were all kind of going through our own things, I feel like we just got so close. We always were supporting people. Like if we weren't in a flare and my brother was, then we would like take our day to help him, or like we kind of always were doing what we could for the other because we didn't need it at the moment. But it was a lot of kind of, yeah, it was very difficult times.
It's a lot of triaging, I think, especially since a lot of the kids' diagnoses were quite squished into probably about a 4 year period, as long as my husband and I had some health issues too, with my lymphoma being in there as one of them. And so it was really hard. It's one thing as a parent to go through this stuff, but when you're seeing your kids struggle, it's a whole other level. And so parents don't have time to be sick, and that was one of the frustrating things is like we have these big health issues, but we don't have time to be sick or in a flare because we've got kids who need us and they need support and they need us emotionally, physically, mentally, socially. So I think, like McKinley said, and that's one of the reasons why she chose to play basketball closer to home, is because family is really important to her. And we're grateful for that. But we really kind of like gelled together as a family, and everyone was just helping each other however we could. And we also understood each other a lot, the frustrations, the tears, the pain. We all understood it and we all saw each other walk through it. And so I think that our immediate family was really a big support. And I would say probably our faith, our church community was a really big support through all of that for us, as well as our medical community. I think once we got diagnoses and once we got things figured out, they became an extended part of our family and really celebrated with the kids once they started, achieving stability and then achieving, for us, it was medical or athletic accolades. No one is happier for you than they were because they saw you at your worst. And so it was really fun to celebrate the wins with them too. But I think it was really important, I would say, from a parent perspective, to keep life as normal as possible for your child who's sick, but also for the siblings. That was really important to us to make sure that we kept trying to do that as much as you can. So I think that was kind of our focus, and our driving goal was trying to take care of the kids that are sick, but making sure that the ones who are not, maybe in a flare and more stable, are still able to do the things that they normally would do. Whether or not that looks like you're still going to go tobogganing as a family and the one kid, needs to be pulled the whole way, or they get driven there and the other ones walk, or, skiing, like however that looked. One stays back and roast marshmallows, the rest of them cross country skiing and come back and join them. I think, I think that's really key because you need to keep some sort of mental stability and a routine and a normalcy. And medical issues, as you know, can be all consuming. It can completely consume your life. And so you have to work really hard at trying to find ways where it still might consume it, but it doesn't feel like it because you're still plugging yourself in with your whatever that might look like, your outlets, the things that are important to you, the things that you like to do, the people you like to see. You have to still make that a priority, which is hard because some things, medical stuff is urgent, but there's still a lot of important stuff you still need to have in order to maintain over a long period of time, because chronic illness isn't just a 2 week thing. It's often a lifetime thing. So,
Yeah, and it seems like you do pretty well in balancing all of that. And there must have been challenges at the beginning, and it sounds like you now know how to navigate situations like these. And I think just like living with a chronic illness has shown us how to like adapt. And I think at first, even when I was diagnosed, I was just like, I feel like my life is over and I won't be able to do anything. But then, like growing up, you realize you can still achieve your dreams and your goals. Maybe there's a different pathway for you, or maybe you need some more time, or just like McKinley was saying, like just maybe having an extra year of school and then doing less courses and managing what you want to do in your priorities. So I feel like there's a lot of options for people, and it's important for them to know that like flexibility and adapting is okay.
mhm.
Yes,
Yes,
totally.
you're right. I
Mm-hmm.
think you just hit the nail on the head. I think a little phrase that someone had said to me, and I think I would echo what you just said, is about you're not necessarily lowering your expectations, you just have to change them. And that was a big thing that really stuck with me as a mom, as an individual, as a friend, as a wife. So I needed to really change my expectations on a lot of things. And I felt like initially I was lowering them, but that's not necessarily true. So
And McKinley, I mean, you were one of the recipients of our scholarship this year, so the STEM Without Limits scholarship. But I want to go back a little bit and maybe you can let us know how you found out about our scholarship in general, and then, why did you want to apply?
Yeah, I heard about well, this scholarship through the Take a Pain Check. Like, I first heard about actually these podcasts through her. She had discovered you guys through your podcasts, and we're like, hey, like, you should look into this. Like, this is a really neat group. And so we kind of like, oh wow, like you guys had like blog posts, all the scholarships, all the podcasts. Like, it was like, wow, this is a whole community of people who have very similar things and very different stories, very similar stories and journeys in which I was going through or had gone through. And so it was just like, yeah, I kind of, once I discovered it, I was like, wow, like this is great. And then I saw the opportunity for the scholarship and I was like, this is also really great. I think let's apply and go from there.
What about you, Lisa? I mean, what was your journey to figuring out Take a Pain Check and getting McKinley involved in some sort of way?
you know what? That's a great question. I'm trying to think if it was, I think maybe it was the Arthritis Society. I feel like maybe they tagged you guys or did something like a year or two ago, like at least a year ago, maybe 2 years ago. And so I'm like, oh, what's this organization? And then I looked into it and I'm like, wow, you guys are doing amazing things. And so I started listening to your podcast and then would send them to Kin. But yeah, really enjoyed sort of seeing and the growth that you guys are doing is phenomenal. Like even just this past conference that you guys put on, like it's amazing stuff. And I think, I'm so excited because all the people that are going to benefit from it, and it's not just patients, it's healthcare professionals too. It's like everybody who's part of it is benefiting from it. So I think I just kind of found it, was like, this is awesome, and then kind of showed it to Kin, and we met with someone. We did an interview at one point with somebody, I think about before you went away to university. Chatted with someone, yeah, a little bit, but it is tricky, as you know. So busy, and
Yeah.
it's so busy with school and chronic disease management, and then training on top of that. So squeaking out any extra little bit sometimes at this period was tricky to figure out how we could do that for her, but
But we figured it out and we made it, and now we're filming, and people are gonna love this episode. I know I am. And so McKinley, like, tell me a little bit about, how you wanted to spend the funds that you received on your education, and also how have your lived experiences shaped the kind of healthcare professional you'd like to be?
Yeah, so I wanted to use those funds and put it like in my education to further in like my kinesiology degree, and to be able to use that degree to help others in the healthcare profession, with all the lived experiences that I've had with my arthritis, my mast cell, and my POTS. It's a wide range of all these experiences with different doctors and everything, and so being able to use my education in a way which I can, whether that's looks, yeah, like the OT setting or something in the healthcare field where I can give back to patients and make them feel understood, make them feel like I get what they're going through, that it's not just like that I'm treating or that we're treating the issue. There's a whole nother, there's the personal piece to it, there's the emotional piece to it, there's the goal piece to it. Like everyone has a story, and I want to be able to use my story to be able to understand and just make the patients feel like they're heard and feel like they're, yeah, understood, and feel like we're working towards a goal and not just necessarily treating the issue and saying, okay, we're done here, next. Like, yeah, I really want to take my education to help others.
Yeah, and really treating the whole person. That's exactly what you mentioned. Like it's not just, treating the physical pain, but as you know, we deal with like isolation, anxiety, depression, like so many other things, the social aspect and all the young adult and youth stuff that comes with the disease. Plus, as you would become an adult, then pregnancy, family planning. I'm sure you know, Lisa, all these different things, right? And we just don't talk about it as often. So, Yeah, I mean, congratulations again for the scholarship. And Lisa, I wanted to ask you, what kind of care do you hope future providers like your daughter can bring to patients?
I think just the level of understanding. I think probably, you know, kind of an approach like it's patient-centered approach is kind of a buzzword right now in healthcare, which is really great. I think in our experience, it would be, sometimes when I would hope that healthcare providers would be like, maybe we don't understand exactly what's going on, but we see you and we know something is, and we're going to help you figure that out. I remember one specific rheumatologist kind of said that at the very beginning, was with McKinley right during the diagnosis. Like she was like, I'm not exactly sure, but like we believe you. We know something's going on, and we're going to help you figure this out. And I just cried. I hugged her actually because I felt like, finally someone, I felt like finally, but it just felt like affirmed that someone was seeing what I was seeing in our daughter, and it wasn't normal and it wasn't right and it wasn't okay for her to live like this. And so I would hope that healthcare continues to move in that direction. And I really think because McKinley knows what that feels like to maybe not be fully understood, or not be understood, not just because of her symptoms, but even we don't fully understand the piece often, even with autoimmune diseases, like there's so many comorbidities, like there's, it doesn't just come in one, there's often so many things that get coupled with it that you might check one off the box and then you're like, okay, well, we still have these symptoms. We got to start now looking into some other things. And so it would be like, okay, we've got this and we're going to kind of journey through this together. So
Before we end off the episode, I thought it would be fun to do a little would you rather game to end it all off on a light note. So, McKinley, I'm gonna give you two scenarios. You could tell me which one you prefer. This might be challenging. I'm reading through them and I'm like, I don't know what I would pick. And then just provide a small explanation afterwards. And Lisa, if you want to share as well, feel free to do so. So the first one is play a championship game during a flare, or miss the game and coach from the sidelines.
It would definitely be play during a championship game during a flare. Definitely did that a lot of times. Not necessarily the championship part of it, but playing through flares, like I said, of just like asking my physio, like, hey, I have a game this week. Like, I'm in a flare. Do you think if I take a Tylenol ahead of time, like, can I try and play? And if they cleared me, then I would just take that Tylenol and try and do whatever I could and then pay the price the next day. But it was, yeah, I definitely would rather play during a flare.
and I'll just add to that too. As a parent, that's where it's really great that there's a team approach, because as a parent, we were always like, you're programmed, you don't want your kid to hurt. And so we knew she'd have races or big games coming up, and we're uh like she's not gonna be able to get out of the vehicle. We're gonna have to carry her around like from the vehicle. She's gonna crawl all night. We knew that was what was coming. And so working with our team and kind of for McKinley sifting through, making sure that when it wasn't a joint flare, or if it was more enthesitis piece, being like, okay, them saying like, yeah, she can't do any damage, permanent damage to her joints. And so as long as she understands the fallout and what it's going to look like, then let her have it, let her go. And so that was helpful as a parent, because then you could kind of go, okay, we'll let it go, and she can help be a part of that decision making, and you know that they're not going to permanently hurt themselves. So that was really helpful to be part of that team approach.
Never explain your condition again, or have every doctor instantly understand your needs.
Every doctor instantly understanding your needs. I feel like that was such a big one of trying to get whether different diagnoses of just trying to understand what you're going through. So if they could all just understand what I was needing, that would I would have saved so much time for sure.
Have your sports team all experience one of your worst flare days for 24 hours, or magically feel 100% understood without them going through it? I feel like I would know this answer, but you know.
Yeah, understand. Everyone just magically understand what I'm going through. I feel like that
Yeah.
would make it very much easier, and I don't want to put them through
Do that. Yeah,
all
like,
that pain and suffering. No.
um,
uh-uh.
yeah, and then the next one is train like an athlete with no pain, but forget about your advocacy journey, or keep everything you've learned or taught others, even with the setbacks.
Definitely keep everything I've learned, even with the setbacks. Like the setbacks and the adversity and the journey has made me like who I am. and made my journey. So taking that away, no, it's made me who I am and made me who I want to be. And so I definitely would want to keep that, even with all the setbacks and the struggle.
And lastly, live in a world where every classroom is accessible or every gym have a specific space for chronic illness athletes.
I'd probably have to say gym space for every chronic illness athletes, because with my experience in the classroom, generally it was a good experience and I didn't have any issues with accommodations. Whereas with some of the sports side of it with different coaches, it was a bit more of a challenge. So if they could have a space for chronic illnesses, then that would definitely be what I would choose.
Awesome. Well, thank you so much, Lisa and McKinley, for coming on today's podcast episode and sharing your perspective living with psoriatic arthritis. We also discussed, basketball, advocating for youth with chronic illness, your medication journey, and basically your resilience and passion to shine through everything that you do. We talked about, STEM Without Limit scholarships and just, what you've been doing to empower other young people with rheumatic diseases. And, your journey reminds us that invisible illness doesn't mean invisible strength. And so we're really excited to see the impact you're going to continue to make in healthcare and beyond. Everyone, make sure to like, comment, and subscribe. Check out McKinley social media channels, and any links we'll leave down below. And I'll see everyone next time on Take a Pain Check. Thank you so much, both of you.
Thank you so much.